I'm very pleased to introduce Dr. Singer this evening. Dr. Singer has taught at several prestigious medical schools, including Harvard, USC, and UCLA. He's a specialist in bone diseases and has been director of both the USC and the Cedars-Sinai bone centers. For the past 18 years, he's been director of the bone disease program at the John Wayne Cancer Institute in Santa Monica and is a clinical professor of medicine at UCLA. Dr. Singer last spoke to our group in October on prostate cancer and bone health, and his talk is an elaboration of part of last October's talk on prostate cancer and bone health. Dr. Singer's long and distinguished research and clinical career of bone diseases makes him particularly qualified to speak about tonight's subject, vitamin D deficiency and its connection to prostate cancer. Please join me in welcoming Dr. Frederick Singer.
Thank you for the introduction, and it's a pleasure to speak in this beautiful hall. I'll call it a hall. That's not appropriate, maybe. So the title of my talk, I was planning to talk quite a bit about prostate cancer and vitamin D, but that's going to take me about 30 seconds to 1 minute, because when you really look through what's been happening, it's much less impressive evidence about the role of vitamin D with prostate cancer. I'll mention briefly what it is. But the fact is, vitamin D affects so many different parts of the body. I think it's more important to talk to everyone, including ladies and gentlemen, about the interesting potential value of vitamin D and being certain about your own status. As many people say, if you develop prostate cancer, in general, you're more likely to die of a stroke or a heart attack, not prostate cancer. That's not to say that men don't die from it, but in many cases, the other more common problems are the difficulty. And there's increasing evidence that vitamin D is really important in that area. So I want to go through this. I'll try not to be too technical, but I think I'm going to try and make you understand what the status of this area is today. This is 2010. 100 years ago, nobody heard of vitamin D. It didn't exist. And in fact, when it was discovered, it was called a vitamin, but it isn't even really a vitamin because it's made in your skin if you get adequate sunshine. So it's misnamed, but the name has stuck. It is actually a factor made by your body, and in some aspects, it's really a hormone. As I'll show you, it gets converted from the substance in the skin, the vitamin D in the skin, and it goes to different organs and becomes a hormone. And maybe even more importantly, it actually acts on many parts of your bodies, important parts, and I think keeps us more healthy if we have an adequate amount of vitamin D. Much of what we're learning is still new and not absolutely proven, so I'll try and tell you what I think is real and what I think is not. So I put, what are the consequences of vitamin D deficiency? Well, it was discovered because of rickets in children, particularly in Northern Europe, where there's not much sun, even in the summertime, and the sun actually doesn't hit the skin in the right way, and so it was very, very common to have severe vitamin D deficiency, and the little kids got terrible bones and didn't grow. And then it was discovered what the factor was. Now, more recently, we've learned that if you're at least somewhat vitamin D deficient, you can develop osteoporosis, or less bone than normal over years. Very importantly, particularly in the aging population, muscle weakness and falls develop. Tuberculosis, I'll show you, is affected by vitamin D. And then I put some question marks: cancer, possibly prostate cancer, diabetes, autoimmune disease like rheumatoid arthritis and things, cardiovascular disease, a huge public health problem, multiple sclerosis, and then cognitive function means how your brain works. So depression and poor memory, potentially there's some evidence that vitamin D deficiency affects the brain in an unpleasant way. I'm not going to talk about everything, but I'm going to run through a bunch of things. So what happens? You go in the sun, and ultraviolet light strikes your skin if you're not covering it with clothes. And if you're in the middle of the world instead of in northern or severely southern latitudes, so if you get the right amount of radiation to your skin, it converts some chemicals in the skin to vitamin D. It's called vitamin D3, or cholecalciferol is a chemical name. That goes in the blood, and it actually doesn't do anything. Vitamin D is dead. It doesn't do anything. It has to go to the liver and get changed a little bit, and then go to the kidney and get changed even more. And then once that factor, which is actually called 125 dihydroxyvitamin D, a very long name, but that factor is like a hormone, because that when it circulates in the blood and it goes to your intestine where there's a lot of blood, it actually stimulates your ability to absorb calcium from your diet, whether it's milk or pills. Many people don't drink milk, but more and more women particularly are taking calcium when they're trying to prevent bone loss. So it works on the intestine, it works on bone, it helps bone continue to be healthy, and it actually works on the kidney a little bit. So it's very complicated. What we understood years ago was that vitamin D was very important for bone, and if you didn't have enough, particularly if you're a growing child, you get rickets. But now we have a whole host of other things to worry about if we don't have vitamin D. So it's become clear in the last 5 to 10 years in various studies of the American population as well as other countries, that, and particularly in this country, the majority of Americans don't receive adequate levels of vitamin D from their diet. We're not talking about the sun now, but the diet. And keep in mind, the dermatologists have publicized widely, if you go in the sun for a long period of time without sunscreen, you've got a much higher chance of having a skin cancer, some of which are easy to treat and cure, and others can kill you, like melanoma. So there's been a big change in 20 or 30 years. A lot of people just don't go in the sun without sunscreen, and when you have sunscreen, you have no vitamin D. It really blocks the production of vitamin D. So in this case, if you're not taking much vitamin D in your diet, you're going to be deficient. And so in this study of a large number of women over 50 years of age, many, close to 70, 90%, particularly the older women, close to 90%, had less than 400 units a day. Well, we know now today, I'll tell you, we don't even believe 400 units is enough. So even if they were taking it, we think a higher amount, which I'll talk about later, is more adequate. So first of all, by nutritional studies, we fail the test of taking vitamin D. And that's throughout the world. Boston is, I think, part of the world, Lebanon, various places in North America, Russia, our friends now, we're friendly with Russia, I think. And then in Minnesota, I'll show you a slide, in northern, Minnesota, wonderful, I love Minnesota in the spring and fall. But in Minnesota, when you look at hip fracture patients, This was a little study showing that in elderly patients, because most hip fracture patients are over 70, when they were admitted to a hospital and blood was drawn, 97.4% were vitamin D deficient. That's close to 100%. So it sounds crazy. How can a rich country like this have so many vitamin D deficient patients? It's through inattention, not through poverty. It's through inattention and not realizing, including the doctors back some years ago, realizing that this was not a good thing that was going on. And nobody really knew much about it until recent years. So in order to know if someone's vitamin D deficient, we take a blood sample, just like some gentleman gave us before the meeting. We take a blood sample and we ask for measurement of the 25-hydroxy vitamin D. That's just a liver product. And that's the best test for vitamin D deficiency. So what influences that? Well, I already said skin being exposed to ultraviolet light. If you have dark skin, highly pigmented skin, it takes more ultraviolet light. So it turns out that, for instance, African American people have generally lower levels because even if they're in the sun, that's not enough. And even if they don't use ultraviolet sunscreening. So if you're very far north, we're in the right location. We're not far north, but in upper Canada and even in Minnesota, the light doesn't work as well on the skin. Sadly, when you get older, the ability of the skin to make vitamin D is less. So we can't help that. That's just the way it is. Sunscreen is one of the biggest problems, I think. It sounds crazy, but air pollution. I don't think you have any here, but in Los Angeles, I said the wrong thing. In Los Angeles, we used to have much more, but we still have some air pollution. Well, they've done some interesting studies. If you go up on a mountain in Brazil and study how much vitamin D is made from the sun, and then you go down into the slums of Rio, there's less vitamin D because the ultraviolet light is sort of affected by the air pollution. Whoops, I'm sorry. I pushed the wrong, I'll go back. So air pollution. And then, of course, a very important thing is how much vitamin D do you take in, whether it's food or supplements. A certain percentage of people don't absorb nutrients very well. Things like colitis, ulcerative colitis, Crohn's disease, or some strange condition called celiac disease. These are all intestinal problems, and these patients, if they're not watched carefully, become quite vitamin D deficient. A lady called me today with Crohn's disease and told me about her vitamin D, so it's not unusual. And then the newest thing that's strange is people with a lot of fat on their body tend to have a lower vitamin D level. It appears that the vitamin D is, once you get it into the blood, if you have a lot of fat, a bunch of it goes into the fat. It may or may not be doing you any good there, but if you have more in the fat than in the blood, you're vitamin D deficient. So actually what it suggests, and we don't really know enough about this, if you're considerably overweight, you probably need to take more vitamin D to keep a normal level. But that hasn't been examined, but that hopefully in the next few years we'll have a better idea about that, because that seems pretty important. So how do we judge what this does? Well, I told you one of the main roles of vitamin D is to help you absorb calcium from your diet. And we don't do these tests very often anymore, but vitamin D can be related, the amount in the blood can be related to how much calcium you can absorb if you're given a little dose of radioactive calcium, a safe dose. So a recent study showed that at a certain level of vitamin D, below that, you absorb less calcium. So this means you're absorbing less calcium. This is a very low vitamin D, and as it goes up, the vitamin D goes up, there's better absorption. And that level, there's different units, but the most common it would be using something called nanograms per milliliter, and that's about 30. So I'm going to keep coming back to this number. You want to have at least 30 nanograms per milliliter, checked by your doctor, at some point in your life. If you've never had that test, I think most people should have that test just to see where they stand. And what happens when you don't absorb calcium, another hormone called PTH, or parathyroid hormone, when your calcium is below 30, the hormone is released. And what does this hormone do? If you can't absorb calcium, that means there's less calcium. And the parathyroid glands, that are 4 little glands in the neck, release more hormone because it's very important for you to have a normal calcium in the blood. So what does that mean? The parathyroid hormone raises the calcium by robbing your bones of calcium. So you actually, over time, if you're vitamin D deficient, you lose bone, and it can worsen or make you have osteoporosis after many years. It doesn't happen overnight. So this is another way of saying this number of 30 is important, because under 30 you start to see an increase of this hormone shown. All these patients are subjects. This was in France. But I think the same thing happens in America. Okay, so I mentioned about muscles, so I think this is very impressive. A group of 4,000 adults had a nutritional testing some years ago, and blood was taken, and then various physical tests were done. There was how fast can you walk 8 feet? That's not very far, but they measure how fast with a stopwatch. And it sounds silly, but how long does it take someone to stand up from a sitting position? Well, your average NBA player can do it very fast. But if you look at a 90-year-old person who's been sitting around all day, there's considerable difficulty in just standing up, someone that hasn't been doing things. But they measured vitamin D, and the lower the vitamin D, on this red graph, the lower the vitamin D, the longer it took to stand up. And as I'll show you, when you find people that are vitamin D deficient and give them enough vitamin D, good things happen. So a number of people have done studies, the benefit of vitamin D in preventing falling. 95% of hip fractures occur when someone falls. 5% occur just walking around. So preventing falls is, in a way, if you could, more effective than taking all those drugs that you read bad things about in the LA Times the other day. So preventing falls would do a huge amount to preventing hip fractures. Bone medicine is also helpful, but falling causes fractures. And it can even fracture in someone that doesn't have terrible bones. So in this study, one group got calcium plus a sugar pill that might have been vitamin D. And the second group on your right got calcium and vitamin D. And after a year, I believe this was a 1-year study, they counted, the people reported how many falls they had. There's a 50% reduction in falls just by taking vitamin D with calcium, but not just calcium alone. And there's 5 or 6 studies like that. So I believe muscle weakness is a part of vitamin D deficiency. And I don't think we had a lot of proof for that 50 years ago, but it's real, I think. Another study in which they gave vitamin D or placebo over a period of several years. The top line shows the number of falls with the vitamin D, and you see the placebo, there were more falls. And then, of course, if you look at what happens after the fall, the vitamin D supplement prevented a certain number of fractures. So the placebo on the bottom, that's the number of people that had fractures. So the longer they went, if they didn't take vitamin D, they had more fractures than if they took vitamin D. So it's just different ways of showing the value of having a good vitamin D intake. So that's kind of a summary of protecting the skeleton by improving the bone or not letting the bone loss occur, and also by strengthening the muscles. But if we look at all the other cells in the body, and most tissues of the body, vitamin D can be manufactured. The active form of vitamin D, this thing that I called 125D. So in the circulation, the kidney makes 125D, but interestingly, the liver factor, the 25 vitamin D, is actually more important than the amount made by the kidney. So if you have a normal vitamin D level, 25, it goes in the cell, and there is the ability of the cell to manufacture this very potent form of vitamin D. But it's in most cells in the body. And then the complex reactions take place, and mainly good things happen when you have enough vitamin D. For instance, if you don't have enough vitamin D, we think that certain cells overgrow. So what does that mean? Well, cancer is a form of overgrowth of cells. So as I'll show you, there is some evidence that various cancers are worse on the patient. There's a worse effect if they're vitamin D deficient. I don't think there's evidence that low vitamin D causes cancer, but I think it may stimulate, in a sense, the nastiness of cancers. So it's another factor besides the cancer itself. There's 200 genes in the body at least that respond to vitamin D. 200. That's too many to show on a slide. So it has possible, extremely wide influence on the function of bodies, as well as diseases that affect human beings. So just showing you something about cancer in general. Sunshine exposure in North America. Where we are in the middle, there's much more sun than north or in Canada. And then people called epidemiologists who study, factors that affect different diseases, such as cancer. So they've looked at, for instance, a common cancer, colon cancer mortality. And interestingly, this is between 1970 and 94. In the northern part of the country, the red that you see means that the death rate from colon cancer is higher than average. So that's not proof, but it raises the question, does vitamin D deficiency make cancer worse? Some people raise the question whether it causes the cancer. I don't believe that, but does it make it worse? This is suggestive, and there's numerous studies, not just with colon cancer, but breast cancer and several other cancers. But interestingly, not prostate cancer. It's very minor bit of evidence about vitamin D in prostate cancer. There was a women's nurses' health study some years ago in which they took a bunch of blood and measured vitamin D, this 25 hydroxyvitamin D, and then looked at the development of cancer. So the ladies that had a normal level of vitamin D had about half the amount of colon cancer over quite a number of years as those that had a low level. So the left is the low levels, and so the relative risk was the highest if you had a low level. But we need studies that say, well, what happens if you give people Vitamin D, does it lower the rate of any cancer? And those are starting now. Those big, huge, expensive studies are starting now. This is the only study that I know of that's published that wasn't really a cancer study, but it was done in Nebraska. It was actually looking at bones in postmenopausal women, bone loss. And there were 4 years, over 1,000 women were followed over 4 years. Some got calcium and vitamin D, and some got calcium only, and some got fake medicine or fake supplements, placebos. And what they looked at was how many patients developed cancer during this 4-year period. And so the women that got, about 1% of the women that got calcium and vitamin D developed one or another cancers. It wasn't just breast cancer, but a variety. There seemed to be possibly a little bit of effect from calcium alone, but the group that got placebos, 6% got cancer. So that's a 6-fold difference. But this was really a study on bones, but they just happened to check on the cancer issue. So that's the only study, but it's a very suggestive that if you have enough, and they give, by the way, 1,100 units of vitamin D every day, which is almost 3 times what has been recommended as what everybody should get. So there's big studies going on, 2 or 3 right now, that are examining many more people. So we'll have an answer in 5 or 6 years or 7 years. There's a lot of articles coming out now about heart disease or high blood pressure, heart disease, any kind of cardiovascular disease, heart attacks. And if you're that number 30 over on the right, so looking at big groups of people from that old nutritional study, if your vitamin D level was above 30, that number 30 comes up again, you had a 6% rate of cardiovascular disease in this population. If it was below 20, it was over 10%. Doesn't seem like a huge difference, but that's a lot of people in a big population. And there's just numerous studies coming out now suggesting that vitamin D deficiency is a major risk factor for heart and disease and strokes. So I think that's extremely important. It needs to be verified, but it looks like it may be real. Tuberculosis used to be quite common, particularly in Europe, Northern Europe, where there's not much sun. In fact, people, before they understood vitamin D, people would go to the Mediterranean and lie in the sun with TB, and for some reason, and many of them did better than if they stayed in London or Scotland. And then they discovered it, in fact, the sunshine made vitamin D, and back then there was no such thing as a sunscreen, way back. So in Indonesia, there's still quite a bit of TB, so a study was done with 67 patients with pulmonary TB, and they got standard medications for TB, but one group got a placebo, a sugar pill, the other group got a fairly high dose of vitamin D, 10,000 units. So what happened to these patients? What they look for is the sputum. They're coughing up the TB germs. So when the germs are found in the sputum, that's a positive sputum. So what they're looking for is does the treatment make the sputum normal or negative? So with the placebo group getting antibiotics, they had fairly good results. 80% of people had a good response. 20% didn't. Vitamin D group, lo and behold, almost every patient had no TB germs with a combination of vitamin D and antibiotics. So that's a small study, but it's a very interesting. I just read a paper from Japan giving vitamin D to children during a flu season, and there was a significant reduction that was placebo versus real vitamin D. So the children that got vitamin D had roughly 30 or 40% less flu than the group that just got a sugar pill. So that's another infection. So there is evidence that vitamin D is important in defending our body against germs. That's through white blood cells and other types of cells that attack germs. So I didn't get a flu shot, but I take vitamin D, and so far haven't gotten it. So, but I don't tell you not to take a flu shot. But take a flu shot and take vitamin D. Diabetes, a huge problem. I hope the healthcare reform can pay for it, but it's an enormous problem. Well, at UCLA, the school up the highway, they took some of the medical students. I don't know if they forced them or they gave them money or they were just volunteers, but they took vitamin D levels on medical students at UCLA. Then they put needles in their arm and put sugar in. That's a testing for how the body responds to sugar. And they found that, astonishingly, some of the students had almost unmeasurable levels of vitamin D. I don't know what they were doing, but they had almost unmeasurable levels. And the lower their level, the higher their blood sugar went in response to this sugar. So that's called insulin resistance. And there's also evidence that insulin can't be manufactured or secreted as well if there's vitamin D deficiency. So I think there's growing evidence that diabetes is affected by, it's not caused by vitamin D deficiency, but it's probably worsened by vitamin D deficiency. So how do we get it again? No sunscreen, go in the sun. And it's been shown that 15 minutes, 3 times a week, with your arms and legs, all your legs exposed, is enough to keep you normal. But who's going to do that religiously, week after week? It's not very convenient, but it does work. We get it a little bit if you eat salmon. That's a high concentration, but you have to eat it every day and quite a bit of it. They do put vitamin D2, usually, not D3, in milk and dairy products. I'll tell you about vitamin D2 and D3 in a second. And mineral supplements they used to mainly have vitamin D2, and now more and more vitamin D3, because that's really the preferable vitamin form. So vitamin D3 is what your skin makes. That's natural. Vitamin D2 comes from an outside the human body source. Mushrooms, for instance, have vitamin D. They irradiate them, and then they extract it. But the problem with vitamin D2, if you give a large amount to normal people, so the top is vitamin D3 in the blood, and the bottom is vitamin D2. Vitamin D2, the unnatural, form, goes out of the blood much faster than vitamin D3. It costs about the same to put in vitamins D2 and D3, so they might as well get rid of vitamin D2, and they're doing that more and more because vitamin D3 will last. If you miss taking some, the vitamin D3 will stay around longer than the vitamin D2, which was the most commonly used supplement. Okay, so I read in the paper, be very careful, you're going to get toxic, you're going to kill yourself if you take too much vitamin D. But let me say that there's a bunch of studies, and intoxication occurs in doses above 10,000 units a day. So 1,000, 2,000, 4,000, 5,000, no problem whatsoever. And so I think one has to be aware, yes, you can take too much. What happens? It makes your calcium in the blood go too high, and that makes you sick. But you have to take generally 30 or 40 or 50,000 every day to do that. Well, nobody's telling people, or shouldn't be telling people to take probably even 10,000. And I know some prostate cancer victims are taking more than 2,000, and I don't think it hurts them. But what I want to say about prostate cancer is the evidence for the vitamin D effect on prostate cancer is unfortunately not very impressive. Yes, in animals that have prostate cancer, you can suppress some of the tumor. Yes, if you grow prostate cancer cells in a laboratory and add high doses of vitamin D, you can suppress it. But unfortunately, in the patient trials giving newer forms of vitamin D, the results have not been very impressive. And also, if you measure vitamin D in a bunch of prostate cancer patients, you can't find any, so far, real correlation between the cancer and a low level. You can in breast cancer, colon cancer, but unfortunately, for whatever reason, it's hard to show it in prostate cancer. That does not mean that a person with prostate cancer shouldn't have a good vitamin D level for all the other reasons. You got enough problem worrying about prostate cancer without diabetes and strokes and all that stuff, and falling down, should we say. So I think, unfortunately, I can't tell you a lot of positive things about vitamin D and prostate cancer, but you just have to know what's real and what's not real. So the final question is, what dose of vitamin D should I take? Well, if you're normal, I know what dose I think I can tell you, but you can't know if you're normal unless your doctor measures serum 25-hydroxyvitamin D. It's not a terribly expensive test, or it shouldn't be. If it's 30, that number 30 again, then 1 to 2,000 units. So we could argue, is 2,000 better than 1,000? 1,000 is minimum. I take 2,000 to be safe or whatever. But it depends also on your body size, so you probably have to take more if you're very large. Vitamin D3 is preferable. I showed you it stays in the blood longer than vitamin D2, although if you take vitamin D2 religiously in the right amount, it's okay. I'm not saying it's bad. It's just not as good. If you turn out to have a low vitamin D level, which literally half of most populations have a low level, even with all the publicity today, because I look at the blood tests at St. John's Hospital, and I can see half the people roughly have below 30, sometimes as low as 5, which is really terrible. So if it's below 30, it depends how far below, and your doctor has to help you get it up. Once it's up to normal, then you can take this dose. So in summary, we concerned this audience about prostate cancer and in general, but your general health is also very important. And since people with prostate cancer can live a long time without big troubles, some have them and others have none, I think understanding the importance for the general health of vitamin D is useful information, and I hope that helps you a little. Before I finish, thank you to all the gentlemen that gave us some blood before the meeting. We can take some more blood. I don't know that we could take everybody's blood because we didn't realize how many people were going to volunteer. It wasn't apparent from the excellent work that was done to set this up. We get a little swamped. If it's possible that, if you want to stay afterwards, we can take some. I don't think we could take everybody that wanted to do it. We didn't know that was going to be the case. We could somehow arrange, if somebody ever wants to drive to Santa Monica on their way to the movies or whatever, you get a hold of me. I can arrange to take your blood up there. No charge, no parking fee, etc. So it would cost nothing. So we'd like to take a little more blood, but I don't know that we have enough material to take a ton of blood. But it's not a matter of my time. It's a matter of I didn't expect such a nice outpouring of help. So thank you.
Levels would you be concerned of people, let's say, if they have 150 nanograms per milliliter in their blood? At what level are you start to begin concerned about toxicity?
Well, I don't think we have the greatest information, but 150 is considered pretty much a toxic level. But if your blood calcium is perfectly normal, you're probably not in big trouble. But I would think something under 100 would be reasonable for the maximum. But we don't really have complete information about that question. But 150 most people would say, cut your dose or get out of the sun or whatever you're doing.
Second quick question on bone density. We've had some conflicting comments from doctors as to how to measure it. Some of them say the DEXA scan is good enough, they can account for calcium, and others say you should have the quantitative CT scan. Now, what are your views on that?
Well, the most commonly used bone density test is called DEXA. Dual X-ray absorptiometry. It's an X-ray. It's an X-ray with a measurement.
Right.
And the problem is, particularly in men over 50 or 60 or way up, arthritis and other changes in the spine completely destroy the utility of a DEXA bone, lumbar spine density. The hip is okay. So I would say that one would pay more attention to the hip in men, particularly that are aging. The quantitative computerized tomography, or QCT, is a better test for the spine because it gets in the center of the bone and for the most part avoids any artifacts. And it's very sensitive. It's also more radiation, although not a huge amount. It's something like a chest X-ray, not like a huge amount. So in general, this QCT is not widely available. There's a few places that do it. The DEXA is widely available in many doctors' offices. So I'd say, the hip would be the one to pay attention to. If you've had a fracture in the spine and the test doesn't give you good results with a DEXA, I tend to do a QCT. Dr. Scholes, who I think talked here recently, sends some of his patients over, and other urologists, interestingly. He's not a urologist, but urologists with prostate cancer patients, we commonly get doing the QCT. But I think the DEXA is okay if you realize you can't pay any attention to the spine. But the spine is very important, so in that case, the CT is a better test. But it's just not widely available. But you can get it done, of course.
Okay, thank you.
This relates to a study done a few years ago in Phoenix where they measured thousands of seniors. They measured their OH25 levels, found that 80% of them were deficient. This is in very sunny Phoenix.
Well, that's what we see.
Yeah, but I had to question, what is the cause of this? Is it the skin conversion where we're using the cholesterol to convert, or is there some molecular cascade in that conversion, or is it the path through the liver and the kidney that's the problem?
As far as we could tell, it's all about the sunscreen. The question was, what accounts for 80% of people in Phoenix having a low level in that sunny, frighteningly sunny place? And it's got to be the sunscreen. There's no evidence that statins really, maybe there will be one day, but statins which lower cholesterol to protect your heart. Cholesterol is 7-deoxycholesterol is in your skin, but I don't think there's any evidence so far that those drugs affect the
But
vitamin D.
relative to the using a sunblock. I don't think it's that. Every time we read papers in that, we read that, well, the aged person doesn't convert well, and I don't think it's because
Well,
of
it's-
sunblock or something else. I'd like to know that so that we don't have to just end up taking supplements for life, that maybe we can do something there to help ourselves.
Well, the aging skin, when studied with the enzymes that make, the vitamin D, has less. I mean, just aging alone, you're correct, plays a role. But if you take a child and put sunscreen on, it wipes out.
Oh, yes.
I mean, it completely wipes out
I
vitamin D.
understand.
So, yeah, I didn't mean to say aging doesn't do it. I had aging on the list. So aging, the problem is that some people who are 90 behave more normally than some people that are 70. It's quite variable. There's a wide range with a given age, so you can't even
Okay.
talk
So
about
essentially,
age.
we had to take our supplements. We don't know how to fix that.
But I mean, the supplements are cheap.
Yes, they are.
And unless you're allergic to something other than the vitamin D in the supplement, it's absolutely safe. So I think it's not a bad deal compared to being deficient.
Thank you, Doctor. I was curious if our levels are normal and we should be taking 1,000 to 2,000 units a day to maintain that. Besides taking supplements, can you get that amount? In other words, a little sun?
Yeah, no,
food?
sunshine, you can do it with sunshine.
How
but
much
you have-
sun would a person?
Well, Dr. Hollick, who's was just featured in the New York Times Magazine, who's been one of the biggest proponents for sun, although he says he takes supplements, Dr. Hollick says 15 minutes, 3 times a week, your whole arms and your whole legs is enough generally to keep a normal level.
Thank
But
you.
I just don't think people are going to get a timer and strip down, and do that religiously week after week. So it's not very practical. It works.
Besides fish, what can you eat? That
Fish are the main
Okay.
source.
Thank you.
There are many companies that make over-the-counter vitamin D3 supplements. Is there any one or more companies that make superior tablets more than any other company, or are
Well-
they pretty much the same?
No one honestly knows, but when people have checked the vitamin D content in 10 different ones, they find a wide range. But remember that vitamin D is considered a natural substance, and the FDA does not regulate, frankly, the supplements, which is probably not a smart thing, for our general health. But so when people ask me which one, I just say, try anything you like, because I have almost no information of any use to tell you. I can't answer. I'm sure some of them are lousy, but which ones? The only way you find out is if you're taking, I would try and stick with one brand, and then after a year or two, if you get a blood level and it's good, praise the Lord, you were lucky. You
Thank
chose
you.
the right one.
Thank you for an excellent presentation, Dr. Singer.
Thank you.
My question is, a person taking 2,000 to 4,000 international units of vitamin D3, is there any known conflicts with other drugs or supplements?
I know of no conflicts. Interesting, if you're vitamin D deficient, and you take one of the bone drugs, Fosamax, whatever, Actonel, it doesn't work as well. So actually, that's a deficiency making a bad result from a drug.
Sounds like it's all positive.
It's all positive so far.
Thank you.
And someday we may tell you to take 4,000 if we have evidence that that's more healthy. But I can't. So far I've pushed myself to 2,000, but that's where it is.
Yes, I've spent most of my time in the sun surfing and sailing, and I have a lot of skin damage on the arms and the face and the legs. And my question is, if Do your legs get, or arms get skin damage so bad that it does not absorb the vitamin D as much? Or
Well, that's
should
a very good question. Possibly, but once more, I think the supplement is the only safe approach to staying healthy. You may be correct, but I haven't read a paper like that. But the dermatologists would say, yes, you damaged yourself, but I don't know that there's evidence for that.
Okay.
But it's an interesting thought.
I've got just a very short question. I wonder whether anybody has done any studies among people who are nudists, whether they are vitamin D deficient.
I don't know if I want to answer that question. I'll look it up, and no, I'm serious, I'll let Harry know if I find
Well,
it.
this is very timely because they're trying to
It may
close
be.
the nudist beach down at San Juan Capistrano, so.
I want to congratulate this gentleman. I've never heard that question before anywhere.
Dr. Schallenberger, in his clinical practice, had vitamin D deficiency that you see, and he's had his patients have their OH25 measured. And he found out that a lot of them, not all of them, sort of had a resistance, just like insulin resistance, and he had to give them a shot of 5,000 IUs for a while to sort of jumpstart them. Have you come across that?
Well, I used to try to use injectable vitamin D years ago in people that had terrible stomach problems, intestinal problems, and had very low levels. But it turns out that whatever was being sold in the United States, I'd give a huge injection and the blood level wouldn't budge. Apparently because whatever was injected just stayed where it was injected and somehow didn't disseminate. And as of today, I haven't looked lately, but I'm not aware of an injectable form of vitamin D2 or D3 that is available even. So it's, obviously you can get a ton of it in with an injection, but it has to enter the bloodstream. And I just didn't understand how whatever that product was I was trying to use, which is no longer on the market. Oh, no, I'm sorry. Oh, I thought you said, well, that's what I do. If someone's very low, you know what I do? If someone's very low and I really don't want to fool around, some people are given 50,000 units once a week or every month. I give them 50,000 units every day for 2 weeks if they're really low. And you don't get in trouble. The level does not go above 100, at least in some studies. So I just as soon get it up and then give them a standard dose. So I agree with doing, what's the point of taking weeks and weeks to get it up for whatever value there is in getting it up fast?
Relative to the toxic levels, the University of Pittsburgh over 10 years ago did that huge vitamin D study, and one of the things they looked at was toxicity, and they determined that a guy would have to take 50,000 IUs a day for several months to get into the toxic range. So I guess that 10,000 that you mentioned is just a safety factor.
That's a safety factor.
Okay.
And the Pittsburgh people have been leaders in trying to use various potent forms of vitamin D to treat prostate cancer. And I've heard the professor that did that give talks, and sadly, he wants a newer form of vitamin D that doesn't raise the calcium, and he thinks he can do something. Maybe he can, but there's no such drug. So it's a little more dangerous than the benefits that could be shown. So I was going to give you a bit of a talk on prostate cancer, but I could not find anything terribly positive to tell you, except that it'll keep the rest of your body maybe in better shape. That's pretty good.
Okay, we're going to adjourn now to draw some blood. If you have any more questions, give 4 tablespoons, and Dr. Singer will answer them. And we want to thank him again and present him with Speaker's Cup.